Hi, I'm Dr. Mariam Alam, and I am going to be presenting to you a case of pregnancy counseling with a NAC OSCE approach. And this video is in partnership with Starmed Medical Education Programs, and it's strictly for educational purpose only. So in the NAC OSCE exam, you can be presented with a case where a patient comes to you with a positive pregnancy test, and they want you to counsel her and address any concerns if she has. So when presented with a case like this, you are expected to address any medical, emotional, or social concerns that the patient has regarding her pregnancy. And you should show empathy and involve her in the shared decision making. So let's begin with a case where a 34-year-old lady is at your clinic and you're being asked to address her concerns, and or it can be simply written that she's here at the clinic with a positive pregnancy test. um, Counsel her regarding the pregnancy and address her concerns. So you will start with history taking and move on to counseling. So for each station at NAC OSCE, you get 11 minutes. um, in those 11 minutes, if it's a station of counseling and post-encounter questions, it would be 8 minutes for the counseling part and the history taking part, and 3 minutes for the post-encounter questions. It can be that you get the whole 11 minutes for the history taking and counseling. So these two can be the scenarios in the NAC OSCE. When you enter the room, uh, you have to begin with confirming the name and age of the patient and introducing yourself, then asking them about what brought them in today. And they will tell you that they're here with a pregnancy test that's positive and maybe any of the concerns that they have regarding the pregnancy. And we will we will address that accordingly and ask questions related to those in our history taking, and I'll also address them in the counseling. And we're going to say, I'm glad that you're here to discuss about your pregnancy test. And to begin with, we are going to ask you some questions regarding your general health and any symptoms that you might be experiencing, and ask them if they're okay with that. And then you start with asking about when their last period was, and ask them about the pregnancy, if it's planned or unplanned. Then just start asking them about their general health symptoms that would include breast tenderness, breast discharge, any pain in the lower abdomen, any changes in the urinary habits, fatigue, weight gain, weight loss, any shortness of breath that she might be experiencing, skin changes, appetite, and nausea and vomiting, fever, headaches. These can be added to it. And bowel habits are also important. So these will give you a general picture of the patient's overall health, and also ask her about what kind of diet she's taking and what is her diet mainly consisting of, what kind of exercise she does, if she do any exercise. Is it high intensity, moderate intensity, how many times a week? So now comes the important component of your history taking, and that's MGOS. MGOS is a mnemonic that helps us remember to take menstrual history, gynecological history, obstetric history, and then the sexual history. Before moving on to questions like these, you are going to ask a transition question from the patient, and that question tells the patient that now you're going to ask some different questions regarding her menstrual history, gynecological, obstetric, and sexual history. And this would ask them if they're okay with that. It's better to start asking with menstrual and then moving on to gynecological and obstetrics. and then asking and giving the confidentiality assurity um, right before you ask the sexual history. So when you ask the menstrual history from the patient, you need to ask about the age of menarche and um, ask them about their cycle length and regularity, the days of flow, is it heavy, is it painful, ask about any intermenstrual bleeding, and you can also ask about how many pads do you use a day. And apart from that, when we ask some questions about gynecological history, ask about the last pap smear, when was it done, and when was what were the results of that pap smear, if any, and ask about any history of sexually transmitted infections or pelvic inflammatory diseases, any sores or lesions. HPV vaccination can be added to this as well. Also ask about any history of cancer, fibroids, polyps, endometriosis, methods of contraception that she might be using before. Then comes the obstetric history. This would include you asking the patient about her previous pregnancies or abortions or stillbirths, and what were the gestational age and the route of delivery. Um, were there any congenital anomalies? Were there any complications regarding the pregnancy or at labor? Um, Before moving on to the sexual history, you have to say this to the patient that now you're going to ask some personal questions, if you don't mind. It is for the purpose of this history, and tell them that you ask these questions to almost all patients. I also want to tell the patient that I want to assure you that the information you provide is absolutely confidential, unless and until it's required by the law, which is rare. And once you get their approval, you um, start by asking the patient about uh, her sexual partner or partners, and ask about when did she first started having sexual activity, how long have she been in this relationship, how stable is the relationship, does she practice sexual safety, and or does she practice safe sex, has she ever been screened for any sexually transmitted infection or HIV before. And yes, again, this uh, any chance of abuse is a very important thing to ask. When she tells you about her relationship with her partner, you can the next question you can ask is about any abuse. It is a very important part of the history to ask about abuse, and you need to ask this to every woman, not just those whose situation raised suspicion of abuse. And it's always important to ask about abuse as early as possible in the pregnancy. So you can ask it right here. Now, moving on to her past medical history, you need to ask about any history of hypertension, diabetes, any blood clotting problems that she might have, or also ask about any history of breast or endometrial or ovarian carcinoma. Um, Also, you can ask about if she has ever been diagnosed with depression or any mood disorders, regarding the surgical history, any major surgeries, or any hospitalizations previously. And medications are very important here. These medications can that she's taken can be teratogenic. So we have to discuss the teratogenicity of the medications, so that they might have to be adjusted or replaced or even stopped if necessary. So Yes, family history is also important here. Ask about any significant disease that runs in the family, any genetic diseases, birth defects, multiple gestation, or even consanguinity. Consanguinity. Uh, this would give you an idea of her of any disease that runs in the family and that you might need to monitor her uh, in this pregnancy. When you ask about medications, you also need to ask about any over-the-counter medications that you might be taking or any herbal medications. So prescription and non-prescription medications both should be asked. Ask about her allergies, immunizations, are they up to date? And yes, that's yes, you can add sleep to it as well. Ask about her sleep, um, how her sleep has been. Again, a very important component of our history would be asking about SAD. SAD is asking questions about smoking, alcohol, and drugs. Very important when you are taking history from a patient whose pregnancy test is positive, because this would give you an idea of about what to counsel her about later in the consultation. Start by asking the patient that actually start by telling the patient that I will now start by asking you some questions regarding your social health, if that's okay with you. And after that, you can ask them if they smoke and ask them for how long have they been smoking, how many times a day, how often, and have they ever, we can also add by asking, have you ever thought about cutting down your smoking? Then moving on to alcohol, ask about how often um, do they drink, how many times a week, what do they drink, and also ask about recreational drugs. Have you tried any recreational drugs? Ask about marijuana. Home support is also important um, thing to be asked. Home environment, how's your home environment? Is there any social support with you? What is your occupation? Occupation would be important because this would give you an idea if her work is stressful and or is it hazardous. Um, so you can counsel about that as well later in your consultation. Now moving on to counseling. Before you start counseling the patient, you can thank the patient for answering your questions and all the information that she has given. Also, by asking the patient if she has any concerns or any questions. Uh, After that, you can start by saying that on the basis of my observation and from what you have told, it appears that you are pregnant. I would also like to confirm your pregnancy with a urine pregnancy test, and this would confirm the diagnosis. Um, Tell her that I will be giving you some prenatal multivitamins to take orally, and we will schedule you for your future prenatal visits subsequently. Um, Regarding her lifestyle modifications, you can tell her that uh, she needs to maintain a balanced nutritional diet as well as physical fitness. If she does any mm, exercises that are high intensity, tell her to transition to some exercises that are moderate intensity, around 150 minutes per week. Also, depending on her history, you need to address if they address her concerns or um, address problems related to domestic violence and if there is any poor social support, also any occupational risk if she works at a place where she is exposed um, to an environment which is hazardous. So we need to address that here. Again, the social history would direct you to the counseling here. So social history, if she has been smoking, tell her that she needs to quit and cut down on her smoking, as it can lead to preterm labor, sudden detachment of placenta, can lead to abortion and stillbirths. Tell the patient that I recommend you to stop alcohol intake because it can lead to a variety of uh, congenital defects, stillbirths. It can also lead to preterm labor and also a syndrome called fetal alcohol syndrome. So alcohol consumption should be avoided. Also, if she's taking any recreational drugs, or that should be addressed here as well. Medications, again, the medication and their teratogenicity should be kept in mind. If you need to replace or adjust any medication or even stop any medication, you will tell about those to the patient. Regarding this infection screening, it depends entirely on the history of the patient. This infection screening would include rubella, hepatitis B antigen, VDRL, chlamydia, gonorrhea, HIV, and TB testing. Now, TB testing would be based on the travel history and any if she has been working in healthcare. So um, this would be important. Also, history of varicella or vaccination and parvovirus immunity if she's exposed to small children. Now, in the end, genetic testing is appropriate for high-risk groups, obviously. Now, this consider the genetic referrals to known carriers, recurrent pregnancy loss and stillbirths, family members with developmental delay, birth anomalies, and genetic diseases. So, and also consanguinities. So, these prenatal and genetic testing uh, are voluntary and they require proper counseling and informed consent before proceeding. So consent should be taken from the patient. And during this counseling session, you can address these issues, like an overview of these issues, and if there are any concerns, because uh, it might be that in the history you have been told that there's a genetic disease that runs in the family. So you need to address that here into the genetic testing accordingly. Now, at the end of the consultation, you might want to direct the patient about what's next. And you will tell her that apart from doing a urine pregnancy test to confirm the diagnosis of her pregnancy, we will also need to perform a pelvic ultrasound to check the age of the fetus and also her expected date of delivery. If you're pregnant, we will check some blood tests and pap smear too if needed. And we will schedule your future prenatal visits subsequently. Um, Also, you can ask the patient here again if she has anything to add or any questions that she wants to ask, and anything that might not have been as clear as it should be in the appointment, so that you can address that again. Thank the patient for all the information, and that's pretty much it. That sums up the case of pregnancy counseling. And if there are 8 minutes for history taking and counseling, you have to adjust your time accordingly, like 4 minutes for history and 4 or 5 minutes for history and 3 minutes for consultation for counseling. Or if you have whole 11 minutes, then you can uh, take your time. So all the best for your exam. Thank you.